Before we start our session today, I would like Maktoum, Deputy Ruler of Dubai and Minister of Finance. May his soul rest in peace. Today, our topic will be on navigating pregnancy and childbirth during COVID-19 and during this pandemic that we are all going through. Today, we have Dr. Shachi Joshi, Specialist OB and Gyno at Medcare JBR Medical Center in Dubai. She will be more than happy to answer your questions, so we encourage you to post your questions on the live through Instagram and Facebook, and I will pass it on to the doctor here. Just a quick note on the topic. It's any pandemic, but especially during the pandemic and COVID, things have changed for sure, and it added more anxiety to anyone, and how to ease our anxiety and how pregnant pandemic. Doctor, thank you so much for being with us here, and I'm sure you'll be more than happy to answer the live questions that will be received.
Entire Maktoum family, and beyond that, a very warm welcome to all our listeners, and thank you Medcare for this brilliant initiative. We're all celebrating Women's Month this whole month of March.
Absolutely,
so
yes.
Really loving that. Now, getting back to our topic for today, I can say as a doctor and from personal experience in being a new mom that pregnancy is a whole journey that comes with its anxiety and apprehension, because it is also a little bit of fear of the unknown.
True.
And then the information that we get on Google nowadays can always scare us. But I would like to reassure you that even in these completely strange and unpredictable times, we have lots of evidence and research even related to the pandemic. And so we are happy to answer all your questions and go ahead from
And the common questions that they ask you during the pandemic.
Thanks for that question, Dalia. Now, beginning with the most common question that we do see, and I completely understand why. How are pregnant women at a higher risk with this pandemic? So let me reassure you by saying that, but yes, there is pregnant, and especially in your third trimester. So that's the 28 weeks onwards in pregnancy, and you do catch the virus, you are at precautions, but especially if you're pregnant, keep your guard a little bit higher.
Sure. Doctor, what about the vaccine now?
I want to begin by saying that as per our DHA guidelines, at present, the vaccine, we don't have enough evidence to recommend its routine administration to pregnant women or to women who are lactating in the first 6 months of their breastfeeding period. Also, one more note, if once you should try and avoid the vaccine, if that makes sense at all. But it's just that we don't have enough studies or evidence.
True.
All the trials that were conducted, pregnant women were not included at that point in those trials. But what is reassuring is we have lots of new data and lots of supportive evidence, and I'm sure we will be changing our guidelines soon.
Absolutely. Coming to the clinic, or you advise them to come to the clinic and continue their checkups?
Yes, please keep all your appointments. Now, this pandemic has changed and evolved our medical healthcare in numerous ways. One of those being the virtual appointments that we've started. So, for every pregnant woman, her course of pregnancy would be tailored to how her health is and how her previous pregnancies have been, or if it's a first pregnancy, looking at the other risk factors involved. But yes, a lot of virtual appointments are incorporated between the office visits, if that makes sense. So generally with our women, we would do office visits along with those appointments in which we need to do some blood tests or we need to do scanning for the baby and things like that. But outside are actually attending all their follow-ups from the convenience of their homes.
Oh, that's very interesting. Doctor, about the virtual checkups, the scans cannot be done virtually, but what checkups would you recommend them to do?
So excellent question again, Dalia. It varies, like I said, depending on the patient. A trimester dating scan, which is around 12 to 13 weeks, the next couple of follow-ups could happen virtually. And again, another follow-up after the 20-week scan, which is another major scan, can happen virtually. Generally, in the third trimester, we do like to see our women in the clinics. And let me reassure you, we are taking all precautions in our clinics to make sure that we can protect all our patients from the pandemic.
Absolutely. Doctor, how can we increase our immune system during pregnancy and during a pandemic?
So I want to begin by saying that pregnancy is a state in which our immune system does get altered. Basically, your body is changing to grow a baby and preparing you for birth. So there are lots of changes happening. But there are certain colorful as possible. So you get all the minerals and vitamins. Up yourself on your water intake. That's essential. Iron, which is an extremely important intake in pregnancy, it actually needs to be doubled to what it was outside of pregnancy. That's because it helps in forming those for her growing baby. Mm-hmm. Another thing that we're all mostly aware of is that it's important to up our vitamin D intake. So either soak those sun rays or take those supplements. So zinc can be taken either in the form of supplements, or you can increase your diet with zinc-rich foods. But that helps our body in repair and healing. It is the fundamental building block inside our DNA. So it is essential. One more thing, catch up at least 7 to 9 hours of sleep. It's definitely important to cope with stress and anxiety, but also helps your body heal. Sure. And last but not the least, try and get exercise on board. So all my pregnant listeners, at least 20 to 30 minutes per day, or if not every day, 5 days a week. Whatever suits you, brisk walking or some yoga relaxation exercises, but any of that is recommended. And you probably know why. It is a good stress buster, but it helps flush toxins away and generally just keeps you happier.
True. Doctor, how about swimming?
Oh,
would you recommend swimming as well during?
Definitely.
I mean, especially with the heat now and
absolutely. And outside of the pandemic, we used to actually have lots of aquanatal classes and sessions. Very good for women with pelvic girdle pain, the pain in the legs and hips and backache and stuff. With the pandemic, just make sure you avoid any crowded places and make sure you're taking all the precautions that everyone is. But yes, definitely recommend that too.
Doctor, we received a very common question and it kept repeating. If a pregnant woman caught COVID-19, can she pass it on to her baby?
Okay, not pass COVID-19 to her baby, either through her amniotic fluid, so that's the fluid around the baby, or through breastfeeding. And we have a lot of data to back that.
Okay, sure. And again, another question. If a pregnant woman does have a cough, fever, and other symptoms, should she rush immediately and do a PCR, or she should be treated at home with the normal remedies and medication?
Okay. Another very good question, Dalia. Now, whether it be cough, fever, or in pregnancy, there are certain atypical symptoms that do come with COVID-19.
Yeah.
I would want our listeners to first not rush or panic, but actually try and speak to your healthcare provider, whether it's your specialist gynecologist or your family physician. Just try and book a virtual consultation, even if you don't want to go down in person. They would be the best equipped to triage your symptoms and then actually decide whether it is necessary for you to get the COVID testing. I mean, even if you do get tested positive, most pregnant healthy women can just home quarantine and do the routine measures. Of course, if you have some other medical problems, then it might be slightly different and we might recommend hospital admission and additional tests. But routinely, it's not required.
In that case, what do you advise?
Okay, this is a mantra I probably use for myself also. I mean, I don't know, when we board flights, flight attendants say that put on your oxygen mask first before putting it on for anyone else.
True.
I mean, that applies for stress and anxiety. They both go hand in hand, and it is important to take care of your own health. As women, we tend to brush our problems under the carpet and staying healthy. We have so many apps nowadays doing things that make you happy, because if you're happier, you'll be able to give the best to your family, your colleagues, and just in general, you'll definitely do better and boost your immunity too in that process. Of course, if you think the symptoms of anxiety and stress are building too much, don't hesitate in taking help from your healthcare provider. Speak to your gynecologist or speak to any other doctor you're more comfortable with, and we can refer you for any further counseling or what we call as cognitive behavioral therapy.
Okay, can you take us through this process, please?
Sure. So there is always a little bit of stigma when it comes to asking for help when it's related to mental health issues.
Absolutely.
But I mean, we are all aware now, it's okay not to be okay. But it's important to recognize that. And if you, like I mentioned earlier, whichever doctor you're comfortable with, please open up to them. mention to them how and what your symptoms are, they would be equipped to triage you and then refer you to, if necessary, some counseling services. So that's what behavioral therapy basically is. And a lot of those sessions can actually now happen online, virtually. So you can do that from your own home.
Sure. Doctor, the common question again that we get is about the antenatal and how hospitals are prepared during COVID and during the pandemic. How can you tell us how the hospitals are prepared?
Sure. So again, I want to reassure all our listeners, we have all measures in place, social distancing. So if you visit our clinics, there are fewer chairs. All the professionals there have face masks on, either been tested positive or a woman with COVID-19 who comes in labor. We try and make sure that she still gets the birth experience that she wants. The only difference is that her healthcare provider will be in full protective equipment, and that is for the safety of her baby, and everyone else.
And after birth, how the babies are treated in hospitals? Can they stay for long, especially if we're talking about C-section, because C-section usually takes more than 3 days in hospital and sometimes longer than that. How are they coping with this during the pandemic?
Yes, I won't lie. I mean, it has been a burden, this whole pandemic, on our whole healthcare system, but we have good regulations and plan in place. It is not recommended that even if the mother does test positive, to actually distance her from her baby. It is still recommended that she breastfeeds. There are 2 ways in which they can go about it. If they wanted to directly feed, they need to make sure they're practicing all the hygiene measures if they've tested positive, and wearing a mask preferably. But they can also choose the option of pumping and then getting someone else to feed the baby.
Doctor, sorry to interrupt you here, but what about the medication that the patients would take? So they take paracetamol and so many other medication. Is that okay for the baby?
Sure. Excellent question again. So most of the routine medications, like you mentioned, paracetamol, if they're taking something with a fever or the pain, all of that is considered safe. Okay, so that's why even breastfeeding, if you're COVID-19 positive, is still recommended actually, because the benefits of breastfeeding outweigh anything. And there is no evidence that the virus can be passed through the breast milk.
Okay. But the medicines, it's not
so
not
most
only
of the medication, like I mentioned, is generally
It's
safe,
fine.
and then it might be to feed. So maybe that doesn't actually hold too much of an importance.
Doctor, usually anxiety and stress would affect breastfeeding and the flow of milk. Can you advise how can we get over it, or how can we kind of release the anxiety and stress, especially during this time for the baby?
Sure. So, like I said, being a new mom myself, one of the most biggest challenges I found personally was establishing breastfeeding. And this was before the pandemic. So I completely empathize with any of the new moms out there. But let me reassure you by saying that, firstly, you have good help available if you need it. We have brilliant lactation consultants, and we can provide a lot of that care through virtual appointments. So you might not actually need to come down to see us in person. Secondly, like we already mentioned before, importance of healthy eating, plenty of fluids, and thirdly, asking for help when you need it. So take a break from all your daily duties, at least for a couple of hours, so that it relieves your stress. Good meditation apps, or going out for exercise, or just watching what you like on television. But make sure you give yourself time so you get those stress busters that are necessary. And
yeah, please.
Sorry,
No, go ahead, please. Sure.
Lastly, I was just coming to the point that there are lots of medications also which help boost breast milk production. But again, that would be best discussed with your healthcare provider, because it would vary according to your pregnancy and your overall health.
Doctor, I got a question live now regarding the C-section.
Sure.
And surgeries.
Question again. I want to reassure all our listeners again by saying that though the pandemic has changed a lot of things, as healthcare providers, we still aim to try and give you the same excellent birth experience that you were hoping for. So, for example, if you wanted a vaginal delivery with an epidural, you can have it. But if you wanted a C-section or need one, you can still have it. So the only difference, like I mentioned earlier, is all your doctors and nursing staff would be in protective equipment. But as such, it does not increase your risk of catching the disease, because we are taking excellent precautions in the hospitals all the time. Again, recovery also should not be affected.
Is there additional tests for pregnant women to do during the pandemic?
Okay, okay. Very good question again. Now, I will be honest. If pregnancy is going on as per plan, routine antenatal care actually hasn't changed massively. We still have the same kind of tests in the first trimester and then going ahead in the later on in pregnancy. If a woman does test positive for COVID-19, then depending on how badly she's been affected by it, there are certain blood tests which are recommended and certain extra scans just for the growth of the baby. But again, this is just because we don't have too much evidence on the study. All the studies so far say that your baby is not affected. So please don't worry.
Another question, how can I keep myself safe during COVID and my unborn child?
Okay.
I think we have mentioned some, but maybe if we can wrap it up.
Definitely, definitely. Firstly, I mean, even outside the pandemic, just try and be your own cheerleader. Surround yourself with everyone who are your cheerleaders. So positivity is extremely important. Following all the measures which the government has recommended all of us to take. So social distancing, keeping your face mask on whenever you go out, avoiding crowded places. I mean, pregnant women still should be able to go for exercise and they should still be able to go for their shopping. Along with that, just stay on top of your health and you should be fine. Hand washing, of course, we shouldn't forget that. So at least 20 seconds. So that's like singing the happy birthday song twice, if that makes sense. But regular hand washing with soap and water or the alcohol gel drops if that's what you prefer. But that's essential. Avoiding touching your face, nose, eyes if you're outside, and well, just trying to avoid unnecessary gatherings if possible, and seeking help whenever you need it.
Sure. Doctor, after birth, is it safe to take?
It's important also for your sanity as a new mom, again coming from experience, to go out and about, but make sure you're avoiding the crowded places and the crowded timings.
Sure. Doctor, before we end our session, if you'd like to wrap up the session in tips, what would you like to share your tips to the audience about the pregnancy during pandemic, anxiety, stress? How can we look after ourselves more from the inside before the outside as well?
Absolutely. So just to summarize to all my listeners, your mental health is equally important as your physical health. So make sure you're having the healthy foods, having enough water, taking your supplements, extremely essential, keeping all your prenatal appointments. Please do not miss them. And if in doubt, just call your healthcare provider. We will be happy to help. And last but not the least, exercise. It is something which is actually proven to be helpful to break the chronic pandemic of the lifestyle diseases that we could transmit from parent to child. So just keep yourself healthy and happy. And I want to reassure our listeners again that we're doing everything possible to give them that birthing experience. Because despite all this news about the pandemic, I don't want them to forget that
our session. Thank you so much for your time. Dr. Shachi Joshi, a specialist in OB and Gyno at Medcare JBR Medical Center. Thank you so much for being with us and answering the questions. And again, our deepest condolences to Al Maktoum family and the entire UAE. Thank you so much and see you in the next